Well, hi everyone, I'm Judy Elliott, and coming up today on Lifestyles for Women, I know many of you are familiar with the pain and stiffness of inflammation in one or more of your joints. Over 50 million people in the United States have been diagnosed with some form of arthritis. Dr. Nick Reed, with Associates in Orthopedics and Sports Medicine, is here to talk with us today to talk specifically about shoulder arthritis and what we can do about it. And we'll be right back with you in just a moment. Hi, and welcome to Lifestyles for Women. We hope you enjoyed today's show. Did you know that over 50 million Americans have been diagnosed with arthritis in some form? Today we have with us Dr. Nick Reed with AOSM to join us to talk about this. And Dr. Reed, thank you so much for being with us today.
Thank you for having me.
You know, we talked a little bit before I actually started to going on air today, but it's unbelievable that we have over 50 million people that have been diagnosed with some type of arthritis. And for some people, people really don't even understand or know about arthritis, and we're going to be focusing more on shoulder arthritis. But what causes shoulder arthritis?
Well, there's different forms of arthritis, so to be specific, you'd have to talk about the type. The most common form of arthritis that affects most Americans is osteoarthritis. And that's your typical wear and tear of the joint just from living. Joints will break down, especially weight-bearing joints such as the knee and the hip. But the shoulder, people are doing a lot of overhead activities can also break the shoulder joint down as well. Other forms of arthritis is rheumatoid arthritis, which is an inflammatory arthritis that is typically passed from family member to family member. Other types of arthritis are post-traumatic, that meaning if you were in a car wreck or something like that and injured the joint or damaged the cartilage within the joint, it can form into arthritis. But I think for this talk, the most common and what most people are affected with is osteoarthritis. And that's, once again, wear and tear just of life. Also, it's genetically passed. So people I hear all the time say, my mother had it or my father had it. That's true. So the actual cause of arthritis, we're still, as physicians, not 100% sure. We think it's multifactorial. That's a fancy word we use to confuse everybody. It just means there's a lot of different causes, and we're not 100% sure of the exact cause of arthritis. But what arthritis actually is the joint itself. And I'll make a comparison. I use this all the time in the clinic, so I'll use it here. If you hard boil an egg, the outside of the egg is smooth, nice. But if you crack that egg, then you've got the cracks running in it. And that's actually, when we're looking at the joint, that's what it looks like. You've got a bunch of cracks running in the joint or the cartilage. And that cartilage will actually peel and flake off, just like a hard-boiled egg. You can peel the layer off. Once that's gone, your cartilage is gone. And then you're left with just bone, exposed bone. Cartilage itself, your body tries to resorb that cartilage, and that's what creates the inflammation and the pain. Your body thinks that something's wrong, and it is. Your cartilage is breaking down. And so you'll begin getting the stiffness and the pain and the swelling of the joints. And that is typically the progression of arthritis, and that's typically the best way I can describe arthritis. It's just, it's a breakdown of the normal cartilage in the joint. Multiple different reasons, but typically wear and tear of the joint.
Right. As far as the shoulder arthritis, do you have a lot of patients who see you because of shoulder arthritis?
Yes.
Because you don't hear a lot of it talked about, really. It's more the knee, the hip.
The general public, and it is, the most common is the replacements that we perform are total knee replacements and total hip replacements. But shoulder arthritis leading to shoulder replacement is not heard about for multiple reasons. Number one, it is less common than the knee and the hip. But number two, the knee and the hip are way far more advanced in the past as far as being able to do replacements. The shoulder's always been lagging behind technology-wise, but now it's caught up. And in my opinion, in some parts, it's surpassed the knee and the hip. Also, younger surgeons are now being trained to do shoulder replacements, and the middle-aged surgeons are having to learn it themselves. So I think as we progress as surgeons and progress with medical technology, shoulder replacements will become more and more common because we now have something to offer those patients.
You know, a lot of people wonder as well, what age do you typically see people who are affected by shoulder arthritis? It
can typically be any age, but osteoarthritis, typical wear and tear of the shoulder, it's usually mid to late 50s, 60s, 70s, 80s. You typically don't see just general breakdown of the joint anywhere before 50, 55. Those are usually people that have been in car wrecks and those type of things if they're having bad shoulder arthritis before 50 or 55. But the most common age, I would say, is greater than 55 years of age.
And that can be very, very painful, can it not?
It can be very disabling. The symptoms of arthritis, the most common reason people seek medical attention is for pain. What typically happens is your pain begins to progress and you start losing motion. And the shoulder joint is one of the most common to lose motion because of pain. And then you have difficulties and problems performing normal activities of daily life, just cleaning yourself or normal hygiene, much less work. People have, when you lose your motion, you lose the ability to work overhead. So the primary symptom is pain. This pain, however, leads to loss of motion. And pain and loss of motion is typically the reason people seek to hunt us down and want us to take care of the problem or fix the problem.
Absolutely. But are there any ways to prevent or reverse arthritis for the shoulder?
There is actually no way to prevent arthritis of the shoulder. We do not have that technology or that answer at this point. If it begins to affect you, there's really no way we can reverse it or even slow it down other than possibly modify your activities. There are treatments out there, and you see the commercials. There's plenty of commercials, people trying to sell things that are not FDA approved to stop or prevent arthritis, and that's knee, hip, shoulder. At this day and age, there's none of those have been clinically proven in trials. They'll tell you that on TV, but none of them have been FDA regulated, and none of them have our stamp of approval. So there's at this point no way to really prevent or reverse arthritis. That's something that I believe will come in the future, however.
Sure. And we're going to be taking a break here, but when we come back, I want to talk about the treatment options with, maybe surgery or other types of treatments that might be available too. So I'm glad you'll be staying with us here, and we hope you'll stay with us here on Lifestyles for Women as we continue talking with Dr. Nick Reed with AOSM, and we'll be back in just a moment. Thanks for joining us back here on Lifestyles for Women as we continue today. We're talking with Dr. Nick Reed with AOSM. We're talking about a very interesting subject today, and that is shoulder arthritis, shoulder pain. A lot of people, when they, Dr. Reed, I'm sure when they come to you, they're like, I am just in so much pain. What can I do? What are some of the treatment options for, other than surgery, first of all, for shoulder arthritis?
Well, when a patient typically presents to the clinic, you're right, the primary complaint is pain and, as we stated before, loss of motion. So I'm always hesitant to offer surgery to anybody the first time I meet them. You should always be suspicious of anybody that wants to operate on you the first time you meet them. But having said that, after we've confirmed that we are dealing with shoulder arthritis, and what you can expect from your surgeon when seeing him is he should examine your shoulder and then perform x-rays. Most of the time, x-rays will tell the story for arthritis. If not, there's other things we can do, such as CT scans or MRIs. But after that has been confirmed, then you're going to discuss treatment options. There's multiple treatment options for shoulder arthritis besides surgery. Number one is just modify your activity. If it only bothers you with doing overhead activities, then I would tell you to avoid any type of major replacement. Try to avoid overhead activities. So number one, what we call is activity modification. Number two is physical therapy. When you talk about physical therapy, it does not reverse or prevent the arthritis. However, it can keep the joint moving, keep the joint supple, and by stretching the muscles and strengthening them around the shoulder, you can actually decrease some of the pain. So physical therapy is a very important in our treatment algorithm. An additional is an injection into the shoulder. Now, most people are very scared and hesitant to get an injection. However, injections are very safe. We typically do a mixture of a numbing medication like a lidocaine or a Marcaine and with a steroid. We typically inject, there's a couple of different places in the shoulder that you can inject, but the arthritis itself, which is in the glenohumeral joint, the main portion of the shoulder with the arthritis, will inject the numbing medicine and steroid within that. Once again, it doesn't prevent it or reverse it, but it can provide big time pain relief for quite some time, sometimes up to months. I've seen people, we inject them and they're good for a year. So if that can delay any type of surgery, I'd also recommend that. Medication-wise, there's multiple different medications, and we're inundated on the TV with different types of commercials for anti-inflammatories or joint supplement medications. And really, to this point, anti-inflammatories are our mainstay of treatment. Medications such as ibuprofen, Advil, Aleve. We do prescription strength ones such as Mobic, Naproxen. There's all types and thousands of them. They all have the same side effect profile. They can cause kidney problems, so you would need to be following with your primary care doctor and getting labs drawn. But taking them for short periods of time, 2 to 3 weeks, months, that should not cause any long-term problems. But really, for non-operative treatment, we're looking at injections, therapy, and medications by mouth. There are also some creams that we can give, anti-inflammatory creams, but none of these are treatments to prevent it or to stop it. It's just basically to alleviate your pain enough to allow you to function in your normal everyday activities.
Right, knowing probably that the pain will eventually come back, so it doesn't exactly, as you say, alleviate it for good.
Right, right.
So I guess that's when maybe after you tried these steps that you have to then consider possibly surgery.
That's right. So I typically would, my patients, and everybody does patients a little differently. My patients, I typically have this discussion with them on the first visit about their diagnosis, try to treat them conservatively or without surgery. And then we proceed ahead if they would like to have a discussion about operative interventions. There's multiple different types of procedures that can be performed on the shoulder. One that you hear about with the knee a lot of times is people going with the scope, the minimally invasive, and just clean up. Well, you're not really doing anything to the arthritis, you're just cleaning up the arthritis. So you're not stopping it or changing the natural history, you're just once again trying to provide some pain relief. I don't think arthroscopy is the answer with shoulder arthritis. You get into shoulder replacements, and there's different types of replacements. You'll also hear minimally invasive, what they call resurfacing procedures, and that's when we go in and we don't actually cut the entire shoulder out and replace it, we just cap the ends, basically putting a piece of metal on the ends. That's actually a very good procedure, and you don't have to have, it's not as large of a procedure as a joint replacement, but that's typically reserved for younger patients. Older patients, we typically do a full replacement on, and that once again is a shoulder replacement being a primary, what we call a primary shoulder replacement, or a regular, or a reverse shoulder replacement. And those are very important to know the difference between the two of those.
So that is really kind of an educational process that you really take the patient through once they come in with pain, and you know, like I said, the first thing is just get me out of the pain.
Right.
But you know, it seems like it's an educational process that you go through with the patient to finally decide what's the best option.
That's right. I look at this as a dance. It's a dance between me as the physician and you as the patient. I want us to work and dance smoothly. You have to know what you're getting into. If you don't know what you're getting into, you should pick another physician or go to a different place. We have to be good partners. We have to make this work. And I tell all my patients, when I cut on you, you become almost like family. And I truly mean that. Like, we're stuck together for life. So if they don't know what they're getting into, then I don't want to do it. So I'll spend great depths of time so you understand shoulder replacement, because this is a life-altering procedure that hopefully will get you to the end of your days. Right.
And, you know, I've known people who've had great results with that as well.
Exactly right.
So, well, we're going to take a break again. So when we come back, we're going to be talking about how the difference is between a total and a reverse, so that you do have some education if you are having to face those kind of situations. So you stay with us again. We appreciate your time, and you stay with us here on Lifestyles for Women as we continue talking with Dr. Nick Reed with AOSM, and we'll be back in just a moment. Thanks for joining us back here again on Lifestyles for Women. As we continue today, we are talking with Dr. Nick Reed with AOSM. Again, Dr. Reed, thank you so much for staying with us and joining us here on Lifestyles for Women.
Thanks for having me.
We're talking about shoulder surgery, and I know there's different types that you talked about. If you find yourself in a situation that you really can't get any relief except having surgery, there are different types of shoulder replacements. Kind of tell me the difference in the two, because you mentioned a reverse shoulder replacement and then a total. Tell me about the
Okay.
difference.
So there's really two types of total shoulder replacements. There's what we call a primary or a standard. So that's your most common shoulder replacement. And then there's a reverse total shoulder replacement. So if you think of the shoulder, and I'm going to use my hands here, that it's a ball and a socket. And so eventually you wear out the cartilage between the ball and the socket and they become bone on bone. So in a standard shoulder replacement, we replace the socket with the piece of plastic. Now, fancy word is called polyethylene, but just call it plastic for short. We replace it with plastic. The ball side, we actually remove the ball as well and place it with metal. So you have metal against plastic, but it looks the same. It's a ball and a socket. And that's for a regular shoulder replacement. A reverse shoulder replacement is we actually reverse the components. So the socket, we actually fasten a ball to. And for the ball, we put a socket. And so now you have instead of a ball and a socket, you have a ball here and a socket down here.
Oh,
So
okay.
you've reversed them, and that's why it's called a reverse. And a normal person would say, why did you do that?
Yeah.
Well, a standard total shoulder replacement is still the most common shoulder replacement performed. The standard total shoulder replacement is for people who have arthritis but a normal rotator cuff. So if you have a normal rotator cuff with shoulder arthritis, then we can put a standard ball and socket in, and the shoulder will still function and move normally. That's if your rotator cuff works. Your rotator cuff has to work for this shoulder replacement to work. And how we know that is because of surgeons that came before me at bigger institutions, and they researched that if you don't have a rotator cuff that works, putting a regular shoulder replacement in will actually fail. And the reason it will fail is because the rotator cuff is what allows you to move and holds everything together. Without your rotator cuff, the head moves all over and will eventually pop the plastic off. So the shoulder replacement will fail. If at all possible, we want to do the regular shoulder replacement, however. The reason for that is it's been around the longest. We know what's going to happen to this. We know at 10, 15 years, 80, 90% of them are still in people and that are still working. You take 80, 90%, that's a pretty good rate over a 15-year period that are still functioning and people are still extremely satisfied. So we know the long-term outcomes and the long-term data with the regular shoulder replacement or a standard shoulder replacement. So if your rotator cuff works and you have arthritis in your shoulder, we want to do the regular or the standard shoulder replacement. The reverse, the reason we had to develop the reverse is not everybody with shoulder arthritis has a normal rotator cuff. If anybody you talk to in the community, almost everybody's had a rotator cuff repair or know somebody that's had a rotator cuff repair. Well, if those people go on to have arthritis and their rotator cuff's torn, if we put the standard in, it will fail. So they developed the reverse total shoulder. So we reverse the ball in the socket. That takes the rotator cuff out of play. You no longer have to have the rotator cuff for this to work. It actually works because your deltoid, the main muscle out here that allows you to raise your arm up, you'll be able to actually use that muscle to raise this and use this shoulder replacement. The reverse total shoulder really doesn't have to have hardly any therapy. It's a fantastic procedure. I'm talking excellent pain results, almost 100% pain result. The function is not as good because you don't have your rotator cuff. So their motion's not as good. Now, as you get older, people tend not to care about that as much as a younger patient would. Also, the reverse has only been in the States for around 10 years. We don't know long-term what's going to happen with the reverse. It may turn out to be just as good as the standard shoulder replacement, and then we'll start using it more and more.
Right.
But we just don't have that long-term data yet to put it in anybody and everybody. So we are very select on the patients that we put those in. And believe it or not, we try to wait for the reverse until you're 65, 70 or older to put the reverse in. Now, there's special circumstances with anything, and oftentimes we have to put them in younger patients, but you really don't want to because we don't know the long-term with it. But short-term, these first 10 years, they seem to be doing excellent.
Well, excellent information, but in addition to that, if a patient has to have surgery, as we talked a little bit about, what should they expect in terms of length of stay in the hospital, recovery time, that type of information? How much time should they allow off of work? Kind of walk me through that real quick.
Okay, so typically the shoulder replacement, you do have to stay in the hospital. But if there's no complications, which typically there are not, you go home the next morning, which is shocking with a major surgery. We let you go home the next morning. You're typically in a sling. Now, if we do the standard total shoulder, you're in a sling for 4 weeks. Working with a therapist starting at essentially 2 weeks after surgery, you start working with a therapist. If you have a reverse total shoulder, we also do a sling for 4 weeks, but we're not as stringent about you staying in the sling. You can come out of the sling and start moving it.
Oh, I wish we had more time.
Oh, that's okay.
I'm sorry that we are out of time. Great information. Can you tell me though, if someone has questions or information about in their their shoulder, they're having arthritis problems with it, how could they talk with you?
You can contact our main office at AOSM, and we'd be more than happy to get you an appointment made and discuss it at links in.
Wow. Love to have you back sometime. Thank you so much for giving us information about
No
this
problem.
important subject. Thank you. And thank you for being with us here on Lifestyles for Women. I've been with Dr. Nick Reed with AOSM, and I hope you have a great day, and we'll see you next time.